primarily elevated pressure in your arteries. Now, the way the human body is designed, you have three types of blood vessels: arteries, then you have your veins, then you have your capillaries. Now, in terms of structure, based on anatomy and physiology, it gives you a what resembles a tree. So the trunk would be the artery, the smaller branches would be the vein, sorry, and the capillaries would be the even finer branches where the leaves are primarily attached to that type of thing. So you understand in terms of size and diameter, your arteries are much larger as compared to the veins. The veins, however, tend to be more elastic. Uh, so when you're looking at hypertension, we know your top number is basically the systolic, and your lower number is a diastolic. You're normally told that your pressure is supposed to be anywhere in the vicinity of maybe about 120 over 80. On the worst side, maybe 130, 135 over maybe about 85. You don't ever want your diastolic to be going in excess of 90, 95, 100. When you pass 100, you're in some serious problems, you know. The body is telling you that it is actually in a stage of emergency. Now, the reason why I'm going through the situation with hypertension is because it is becoming more and more worrisome that we have a lot of citizens in this country who are being told, or who are coming to the stark realization that they have serious problems with their kidneys, problems so bad that you could actually be now recommended to be placed on dialysis. And the thing is, as a integrative health practitioner and a practitioner in general, I find it's very difficult for someone to be afflicted with something and not really know. So that's one of the first things that you need to find out. Find out if you have hypertension. Now you might ask, how would I know if I am hypertensive? Okay, so it's a very easy thing. They actually have blood pressure monitors that they sell, and those devices are not, extremely expensive. It is relatively affordable. I mean, as regards to your health in comparison. So it doesn't take anything out of you to go and get a blood pressure monitor. And the reason I'm saying that to you is because more and more persons have been hypertensive for years and they didn't know. But what makes that a serious issue is that a lot of the times damage and significant damage has been done to your renal artery, which in turn causes damage to your kidneys, which would now put you in a situation where you may go to the doctor. They might run blood tests and they realize, but wait, your creatinine is high, your bone is high. Because, of course, there are certain things that the kidney is supposed to filter. And when you run blood tests, if these are higher in the blood, it is an indication that the kidney is not functioning properly. Then they might go and do something known as a glomerular filtration rate, which gives you the stage at which the kidney is at. You have generally 6 stages: stage 1, 2, 3, 3A, 3B, 4, 5. Now, the thing is, if you're stage 5 or stage 4, you're usually in a terrible situation, because it means they're now going to tell you, listen, we have to put you on dialysis. Now, I'm saying all of this to say that if you know you have high blood pressure, take this piece of advice. Get some sort of diary or something, and get a proper working hypertension or a blood pressure monitor, and check your blood pressure every day around the same time, and write it down. Keep a journal of it. Because you see, what we have to be mindful of, we have to be a little more consistent and disciplined as regards to these things. Because Trinidad and Tobago has reached a situation where we almost do not have enough dialysis centers because of the amount of people that have to dialyze as a result of having renal failure. And 99% of these people, and I say that without any reservation, ended up in that situation because they were hypertensive for years, and or they were hypertensive before they were actually diagnosed as being hypertensive and doing some treatment protocol, and a lot of the damage was done. A lot of persons don't understand that high blood pressure is not something to play with. Diabetes is exceptionally bad, as well as hypertension. But you know what makes it worse with high blood pressure? High blood pressure is very volatile. So it is impacted by your emotions. So, for example, somebody annoys you, you get angry with children, family, whatever the case may be. You're driving. Trinidadian drivers are very courteous drivers. So, they give you a bad drive. The thing is, that could actually cause elevation in your blood pressure.
Correct.
If you have stress, you're not sleeping properly. And what makes it very volatile and dangerous is that you could go to bed and a number of things could happen to you. One, you may not get back up because you may die from an aneurysm, a brain aneurysm,
Right.
or you may experience a stroke, whether it's an ischemic or hemorrhagic stroke. You can go blind. So with diabetes, it tends to take a little while longer in the sense that, you're, how to put it, it's almost as if your deterioration with diabetes is almost timed and controlled to an extent. With hypertension, that is not the case. So I'm saying all of that to say today, if you are someone who suffers with hypertension, mind your business, because the kidney is the most unforgiving organ in the body.
Correct.
And I say that because when you're doing clinical nutrition, which is nutrition for disease, and your objective is to do reversal in terms of damage, especially lower inflammation, naturally, that type of thing. The other organs tend to give you a quicker response. Cardiovascular, the heart, liver is a very easy-ish organ to deal with once. I mean, if you get cirrhosis or the liver, we might have some work to do, but still. But you see, your kidneys,
Unforgiving.
unforgiving organ. That organ, because the dietary requirements that you have to follow when you are when you have an issue with your kidney is significant, because remember, you cannot use high potassium foods. So it means there are a number of things in your diet that we have to do a lot of work on and that type of thing. The good thing about it is that your kidneys respond to exercise very quickly. And studies have shown that persons who had serious issues with renal failure and that type of thing, they were actually placed on an exercise protocol. And of course, they looked at these persons over a 12-month period. All of them were actually like stage 5, stage 4 kidney. And what they realized is that just with exercise alone, this is not even a nutritional protocol. This is not a supplemental protocol, a protocol that is designed to reduce inflammation in the body naturally. Just with exercise, they were actually able to see over that 1-year period a 35% improvement in renal function. The blood pressure was improved in instances where the candidates, because most of the candidates were either hypertensive, diabetic with renal issues, or hypertensive with renal issues. So they were looking generally at what improvements they got just with exercise. So that alone tells you exactly what it is you need to do. Those telephone numbers, of course, and locations, you can visit us at our Shoguna's office.
So the number is 222-8261. I repeat, the number is 222-8261. Our DB branch is 223-7515. I repeat, 223-7515.
Okay, good. And keep in mind, of course, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. Any questions as yet, sir?
Concerning, well, of course, the favorite topic there, diabetes, right? Feeling the sensation under the feet, is that always a sign of being diabetic? Somebody here says they're getting pain under their feet a lot, like early in the mornings, that kind of thing.
Okay. Well, the thing is, if you haven't been diagnosed as a diabetic, because that feeling sometimes has a lot to do with neuropathy or nerve problems, you could have an indication associated with poor circulation. However, the better thing to do would be to go to your healthcare provider and have a HbA1c done. Or if you come to Batson Associates, we just do it and refer you to get it done. A1c will give you a reading of your blood glucose over a 3-month period. And it is usually the general standard used to determine if you are diabetic, pre-diabetic, or what your situation is as it relates to how your body metabolizes glucose. When we have done that and it is established that you have a diabetic situation, because normally in that A1C, we normally like any figures 6 and below is good. When you start past 6.2, 6.5, you tend to be pre-diabetic. Of course, anything over 6.8, you are considered a diabetic. Now, I said considered in the sense that we actually now could make corrective measures, because all diabetics, whether you're type 1, which is an insulin-dependent diabetic, which means that your body's not producing, or your pancreas rather, is not producing sufficient insulin, but it doesn't mean that it's not producing any insulin at all. I mean, there are persons over a period of time that could happen to, but those are usually complicated persons with a number of additional health concerns, issues with the endocrine system, so they may have thyroid problems, those type of things. But apart from that, generally your pancreas would be producing some percentage of insulin. The percentage is just on the lower end, and there are things that you could do to actually improve that situation. Then, of course, with type 2 diabetes, the pancreas is producing insulin, but those receptor cells are not responding properly. So as a result of that, you would be put on diabetic medication, so things like glucophage, diamicron, Dionil, Genovia, whatever the case may be. The point is, in all instances, if correction is made, then a number of improvements could take place. One of the things we do at Batson Associates is an integrative diabetes center where we treat diabetics whose objective is to improve their diabetic situation. What do I mean by that? Because once you're a diabetic, you have problems with neuropathy. So you could have pins and needles, cramping your calves, burning under your feet. Because your circulation is so compromised, you can have problems with your eyes very easily. Your likelihood of getting a stroke is significantly increased by about 40-45%. So it means now that in that integrative clinic, our objective is to correct and let me not say slow down, but in some cases slow down and even reverse those types of symptomology. Because with improved blood glucose management, with improves weight management, that's the next thing. A lot of persons who are diabetic have a weight situation. And of course, if you are obese, or the more you're out of your body mass and your body composition statistics, the easier it is for you to actually have worse symptomology associated with diabetes. So neuropathy, poor circulation, you could end up in a situation where you are an amputee, because so you could actually lose your toes or lose your limbs as a result of that. The eyesight situation is very concerning because of that high level of oxidative stress caused by diabetes and inflammation. You find that diabetics tend to have a lot of problems with their eyes. We would offer guidance for you as regards to proper management in terms of your dietetics, supplementation, that type of thing. So that's something you could always look out for and get information. You can visit us at any one of our locations. That telephone number again for Shaguanas.
For Shaguanas is 222-8261. I repeat, the number is 222-8261. The St. James number is 220-8113. I repeat, the St. James number is 220-8113. And the Tobago number is 226-4553. That is 226-4553.
Good. In addition to that, again, we are live on our social media platform. So we are Batson Associates Limited on Facebook. On Instagram, we are Batson Associates TT. And on YouTube, we are Batson and Associates Trinidad. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates. Any more questions on your side, sir?
Yes, a question, doctor. I am taking injections for my eyes for the past 3.5 years because of my eyes are bleeding. My doctor keeps telling me it will get better every time I visit. Can you please give me another opinion?
The thing is that person most likely suffers from what is known as diabetic retinopathy, and that is where the retina becomes detached. And as a result of that, you actually have blood pooling at the back of the eyes. Now, in some instances, you may find diabetics, it may not necessarily be detached as yet, or it could be a situation where there's serious inflammation or inflammatory response at the back of the eyes. And this is something that's very common to diabetics. As regards to the injection, normally there are injections that are administered. Me personally, and as regards to my professional opinion and experience, I really don't like when they inject diabetic eyes. In my personal experience, as I said, I find it doesn't augur well for the patient.
Correct.
I personally would prefer you actually fix the inflammation in the body. One of the things that, again, diabetics have to understand is because of that high level of inflammation caused by excess glucose in the bloodstream. Because you have to understand the way the body is designed from the perspective of anatomy and physiology. Glucose is not supposed to be in your bloodstream for an extended period of time. Glucose is normally stored in the cells, and your body, when the body is ready for the glucose, which it utilizes as energy, those processes and whatnot, the body undergoes that, and the glucose is released. So it is not there for an extended period. That is the problem that diabetics have. So it means now that the body breaks down easily, and healing is much more difficult. So I mean, in a case like that, as I said, I don't find the injections sometimes work well enough. And if it is you do them, you have to get some sort of complementary protocol. So I would recommend definitely some sort of nutritional protocol. You can give us a visit, give us a call, and we can now guide you in that direction. Because when you're looking at that type of inflammation, one, you have to reduce the inflammation. If the inflammation in the back of the eyes remain high, it is just going to continue worsening the vision. And in reducing the inflammation, if there's bleeding as well, that is also going to reduce, which is exactly what it is you want. So I'll suggest you give us a call. That number again for Shogunas is 222-8261. That's 222-8261. The WhatsApp is 314-9975. 314-9975. Any more questions, sir?
Yes, question. Good day,
Go
doctor.
ahead.
I did a prostate exam and did some blood work. The results came back, and PSA is 12.750. What should be my next step?
Well, your next step would definitely, well, the thing is, we know PSA is a blood test that is performed. It stands for prosthetic specific antigen. So once those antigens, the usual range is 0 to 4. This individual is way over 4, so they like 12. So that is an indication of either one of the three things. So it could be considered benign prostatic hyperplasia. It could be prostatitis, which is infection of the prostate.
Correct.
So the next move I would recommend is at least get a prostate ultrasound done. The thing is, I always tell persons I'm not in the politics of medicine, and believe me, that is exactly where I stand or sit. And the reason for that is that some persons would recommend a biopsy. Now, a biopsy is where you'd actually now go in and take 12 samples, and it's sent and to determine if it is cancerous or not. My issue with that is that if you go in that direction, you open the body, because once there is any incision in the human body, you open up your body to two things, which is infection and oxygen, right? I mean, anybody in the medical field knows that. So, in some quarters, a lot of persons don't like it. I am one of those persons. I really don't like it. So I personally wouldn't suggest you do that. I would suggest a prostate ultrasound. And if you can always bring those records, we can have a conversation and now work on the inflammation. Because what the body is telling you is that there's inflammatory response in the prostate. The question is, where is the inflammation coming from? What is causing the inflammation? I'll say something quickly. Two things. Persons who have serious gastrointestinal problems. So in other words, if you're a man and you constantly have problems with like acid reflux, bloating, gas, flatulence, you're always constipated, that you need to be careful, because your prostate and your colon is basically neighbors. And what happens, you could have fecal loading where your body doesn't empty feces properly. And as a result of that, that fecal matter stays in the colon and actually causes problems in the adjoining prostate. That's one. And two, if you are someone who deals with chemicals, so your job involves working, like for example, you might be working in oil and gas, you might be someone who is an auto mechanic, you might be someone who is involved in farming, and as a result of that, you would be spraying and what. People who remember, all those chemicals are carcinogens. What are carcinogens? Cancer-causing chemicals. So if you interact with those based on your profession on a regular basis, then you need to pay attention. All the prostate cancer patients that I have seen within the past 2 years, at least 65%, 75% of them were persons involved in agriculture, auto mechanics, body work. So it is cause for concern. You need to really pay attention to those. So that would be my advice as regards to where that is concerned. Get a prostate ultrasound done. If it is you need to, you could always come to us. We could give you the referral, have it done, and then we dot our I's and cross our T's from there. Okay.
Okay, that's it for now.
Okay, next. So back to what we was discussing. Keep in mind again, we are live on our social media platform. We are Batson and Associates Limited on Facebook. On Instagram, we have Batson and Associates TT. Let me say a pleasant good afternoon to Miss Dawn Ellis, who is joining us from Columbus, Ohio, and a pleasant good afternoon to Miss Nicola Hurd, who is actually joining us from St. Lucia. So back to what we're discussing, hypertension. So you have primary hypertension and secondary hypertension. So secondary hypertension is hypertension caused by a primary cause. Now, in other words, you could have 10 persons who are hypertensive, but we have 10 different reasons why they are hypertensive. Okay, so for example, you might have a female who is going through PMS, which is an acronym for postmenopausal syndrome. And we know, Mr. Bustamante,
Yes.
as a blood microscopist consultant at Batson Associates, one of the things we do is dry blood, right?
Correct.
And in that dry blood, I personally like it because you're actually able to see oxidative stress, you're able to see inflammatory response in the body. It also gives you some aspect of biological age based on the terrain, because blood is life. Blood is basically a mirror of the human body, right? From your experience as it relates to clients with prostate problems, how does that sample usually look? What are some of the things that you pick up in there?
So generally speaking, most of the clients who come to us who have very, very high PSAs, what we would notice is anomalies with regard to the dry sampling. So we'll see high levels of oxidative stress, also inflammation in that dry sample. So the oxidative stress is very, very profound. What we try to do at Batson and Associates is actually reverse back that. So the blood could actually pull back nicely and the connections between that dry sample could be improved.
Okay. One of the things as well too, as I was saying, as it relates to anatomy and physiology, based on how the body is designed, in terms of the location of the prostate to the bowels,
Yes.
you often find a lot of individuals with that particular situation there. They usually have problems. Just up to recent, I had a ultrasound. It was not ultrasound. That was actually a CT scan. And one of the things in the CT, it mentioned, fecal loading. And that individual has a problem with the prostate. And I always tell persons, one of the things that men need to pay very close attention to is you need to check yourself very early. Some years ago, they used to tell us 40. I do agree with that. I tell them, I think in some instances, depending on the job that you do, I think 30 years is at least a good enough time to go and check yourself. And then you need to be also mindful of you in terms of yourself, how you treat yourself. If you're not, you're someone who eat pretty well, you drink a lot of water, you take care of yourself, you might work out, might necessarily be gym, but you're physical, so you walk, you run, whatever the case may be. So you're sort of stacking the odds in your favor. Now, if you come from a family where that actually is something that, some family member, whether it's your father, grandfather, someone may have had an issue there, you have the new word that COVID gave us, comorbidities. You have those other things. So you might have diabetes, you may have a problem with your thyroid. Then it means now that you should check even earlier and have your checks done, whether it's every year, every 2 years. In addition to that as well, too, as it relates to that situation with the amount of meat. I often tell, and men don't like to hear this because, sometimes men tend to be a lot of meat mouths, although I think women eat way more meat than men.
Yes.
In some instances, they really, really could put down a lot. But in any case, it have those individuals who, they eat meat all the time.
Yes.
And they indulge in everything. They will have pork, beef, everything. A word of advice is you need to ensure that you do some sort of detoxification where that is concerned. Recently I had a client in the office and they didn't understand why excessive amounts of meat was so dangerous. And until I explained, when you look at the body, it has to break down. That is protein you're dealing with. And not only that, you have a lot of nitrogenous waste in that whole breakdown, in terms of metabolism and that type of thing. So what happens there is that it's very easy for to have high blood pressure, you usually find hypertensive people, and that's the topic primarily that we're speaking about today, tend to be usually persons who eat or consume high amounts of meat.
Correct.
I find that
Definitely.
I told someone in the years that I've been working, the worst hypertension numbers I've ever seen in my life is in Tobago. I've never seen, and I mean, I'm not attempting to be, condescending or facetious in any way there.
It's true.
It is true.
Yes.
The worst, I've seen persons come with blood pressure 200 and something, 150 something. I mean, that's craziness. And even if you look at when we start to work with those clients and they bring the journals for us, and we look at it, we're talking about very high numbers. And that usually has a lot to do, because of the high pork consumption, a lot of meat, a lot of saturated fats in the diets.
Correct.
So again, that's something that you personally need to pay close attention to. As I said, my advice is you get a pressure monitor. Is not $1 million. Get a monitor and test your blood pressure on a daily basis and mind your business, even if you are on medication. Because, as I said, you could ask anyone. There are a lot of persons now, and this is something I've been warning people about for years. They do not know they're hypertensive, and they only realize 5-10 years down the road they have high blood pressure. And then they may be diagnosed, they may be put on a treatment protocol, so you might be given some enalapril, atenolol, whatever the case may be, or some sort of water tablet, so either Lasix or Benadryl or something like that. And you may start now, but then you realize 2 years down the road, you're being told that you have kidney problems, renal failure, and you have to be placed on dialysis. No news that anyone would want to hear. Believe me, dialysis is not a vacation. You ain't going and lie down on the beach and drink margaritas and things. There is nothing nice about that. So if you can avoid it, please avoid it. So again, those of you who are hypertensive, one of the things you could also check out too, there's a product we carry at Batson and Associates called Circulation Regeneration Tea. And that tea was specifically one that was done for hypertension and circulation, because as I said, we deal with so many diabetic clients that we carry a lot of products for circulation, because that's one of the main issues that our diabetic patients have. So we always have to strive to improve that from a natural perspective, to help with things like pins and needles, cramping in your cars, burning on their feet, and most importantly, the eye damage. Again, too many individuals are ending up with detached retina. That same gentleman that asked the question about that situation with the back of the eye, he's not alone. He's not alone. Remember, when you are diabetic and you are hypertensive, your likelihood of developing or having a stroke is significantly increased, in excess of the 35th percentile. We're looking at over 50%. So it again, pay attention and check your blood pressure on a daily basis. Do not take medication blindly. The same applies to the diabetics. You are diabetic, you are on a protocol. Yes and no. Sometimes you're annoyed. You have to be choking your finger all the time and you might be doing this. But you can only manage what you measure.
Correct.
It's like somebody trying to lose weight and you never go on a scale and you're going with your feelings. Well, and checking, well, this pants used to fit you, so it's not fitting you again, so you feel you lose 5. No, you would not be able to track anything properly because the management protocol is not sufficient. So again, you could only manage what you measure. Very, very important. Test those, have those numbers on a daily basis. And even more so, that with your management, you could actually take that and carry it back to the clinic. Because there are some persons who suffer from white coat syndrome. You go anywhere and you'll be testing your blood pressure home, the blood pressure is good. From the time you reach in a doctor's office, it highs. That is your subconscious mind that you have no control over. So you're going to get a very high reading. But if you have your records with you and you show the doctor had no other choice but to say, okay, this, and he might have to adjust the medication, he or she, and make the necessary changes. But they can only do that if you have the information. That's very, very important. So again, those telephone numbers, and also check out our Santulan, that 7-channel detoxification, which cleans and detoxify kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. Third base, sir. Any questions again?
Yes, so somebody here about been getting, we do have a call. Let's take this call first. Hello, good afternoon. Hello, good afternoon, caller. All right.
Okay.
I've lost that one there. 627-3223, 625-2257. Of course, you're listening to Batson and Associate Holistic Health. Somebody was calling here about getting frequent headaches. I've been getting frequent headaches. Tested my eyes, everything was okay. Any sign for that?
Any advice? Well, the thing is, headaches, I often tell persons headaches is sometimes a clear indication of dehydration. So some persons drink water, but you have one of two challenges. Sometimes your body don't absorb the water that you're drinking, or it is not utilized. It just goes through the system. And there are a number of things that could cause that: lactic acidosis, imbalance of pH in certain parts of the body, like the mouth, for example, because the pH of your mouth is supposed to be like about 6.4, which is acidic, as opposed to the pH of blood, which is about 7.3 on that acid alkaline scale. So if it is you're experiencing that, that could be something that you need to pay close attention to. You could always give us a call or visit as regards to that particular situation.
Let's take the call that we were getting here. Hello,
Okay.
good afternoon. Afternoon, sir. Hello. Yes, go ahead.
Hi, good afternoon, sir.
Mr. Batson, may I ask a question, please?
Yes, sir. Go ahead.
These drops of blood, you take in a piece of glass and put it on an instrument.
Mm-hmm.
What do you call it?
What it is you call it?
Yeah, how you call that test?
That is called live blood microscopy, sir.
Okay. If I come to you, right?
Yes, sir.
If I did not tell you what is my complaint,
Mm-hmm.
tell me my complaint?
Of course it can. Definitely.
Yes.
Definitely. In detail too.
Pardon me?
I said it can in detail too. So I could explain. Okay. He's there still, sir? Or he's gone?
He's gone.
He's gone. Okay, good. Yeah. So what I was going to say is, yeah, that gives you don't have to tell me anything. You could come down, sit down, and try and fib, and don't tell us what you eat. Tell us you drink water, and we're going to see it. You're going to see it. Blood is life. And then the thing is, because of how that sample is, you're actually looking at live blood. You're looking, just take the blood from, that's capillary blood, which we use from the tip of your fingertips. The thing is, in medicine, one of the things, blood is the greatest or the most tested serum. It is the greatest witness. So what that does, especially the dry blood, as I was explaining, it tells us something known as inflammatory response, or what is known as oxidative stress. There are a number of times clients have come to us and we did blood analysis on them, and then I sent them for CA1 to 5 and various cancer antigen tests to determine what it is I saw there. And we were right. And it's not as if it is we were telling them that they had cancer, but when they sent to do the CAs and the various other tests or diagnostics, it confirmed what it is we saw. Now, the thing is, that's not to frighten anyone, but the mere fact that we could see inflammation that early, it just goes to show that it is something that you can actually use. The thing is, in places like Germany and various parts of Europe and even various parts of the United States, clinics employ blood microscopist technicians to do their work, because it actually makes them look very good. Because apart from your complimentary blood test, when you have this array of information in front of you, you now have the ability to help the client. I'll give you a very quick example. There was someone who came to us who had problems. They had severe headaches. They had headaches for 10 years. I mean, who has headaches for 10 years? I don't know what I had to do to myself. Anyway, they came and they did a number of tests. They did scans. They couldn't tell them what is wrong with them. Okay, good, no problem. The blood analysis was done. I got the report. I looked at the report. The first thing that we saw when we looked at that blood sample is that all the blood cells were stacking and sticking up together. Now, remember, the purpose of blood is to transport what? Oxygen and nutrients to cells. So the thing is, if your blood cells are stacking together and sticking up, it means its ability to transport blood is significantly impeded. It now means that your circulatory system is going to be compromised. It means your brain is going to be starved of oxygen and nutrients. So if your brain is not getting sufficient oxygen and nutrients because the blood flow is impeded, the blood is too thick, the blood is stacking together, you do not have proper oxygen exchange between cells. Isn't it obvious that you're going to have headaches? Obvious. And that's the problem. And then when we made the necessary corrections and whatever was done, in about 2 weeks' time, the person's headaches stopped and they have never had headaches again. And this was what, like about 3-4 years ago. And they're still a client of ours. So the thing is, that's a perfect example to show how your biological terrain is important. If you take a cactus out of the desert and you put it in the Caroni swamp, it cannot live, because that biological terrain is not conducive for the survival of that species or that plant. The human body is the same thing. If your gastrointestinal system, if you're not evacuating waste properly, you know how much people think that being constipated means that you're not going in the washroom on a daily basis. That is not what constipation is. You could be getting a bowel movement every day and be constipated. You know why? Your body or your bowels are not evacuating waste properly. Remember, your colon is 23 feet in length, you know. You're ascending, transverse, descending, sigmoid colon. That's wrapped up in that aspect of the body. So the thing is, if you're not emptying waste properly, you don't drink sufficient water, if you have a very big stomach, I always tell persons, and again, this is not to be facetious or condescending, if you have a very large stomach in comparison to everything else, your shoulder width, your waist, and that type of thing, that is a serious indication that something is wrong with you. And it could also be an accumulation of something known as visceral fat. And if you research that, visceral, visceral fat is organ fat. That fat kills you while you are sleeping. So when you are diabetic, injecting yourself with insulin in your belly or your stomach every day, your visceral fat is going to increase. You cannot have proper insulin or glucose management there. That's why a lot of persons who take insulin, they end up with worse problems associated with blood sugar, because you're not really dealing with that root aspect of the problem. Okay, so that's something to pay very close attention to. So again, those telephone numbers and locations, we are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Shogunas. That telephone number is
222-8261. I repeat, that is 222-8261. The DBA number is 223-7515. That is 223-7515. The St. James number is 220-8113. I repeat, 220-8113. And the Tobago number is 226-4553. That is 226-4553.
Great. Third base, sir, always a pleasure to be in your company. As we always say at Batson and Associates, if you think health is expensive,
try sickness.
If you think education is expensive, try ignorance. Third base, sir, and the listeners of 106.5 FM, be safe. Until next week, please, God. God bless.
Thank you very much, sir. Of course, you've been listening to Batson Associates right here on Freedom 106.5.
The gates are open. At the end.
So, social media, let me say, of course, a pleasant good afternoon to Kilo 29. So, again, Miss Marcia Letrin, a pleasant good afternoon to you. Miss Naomi Viola, good day. She says, how can PMS be managed? You need to come to the office.
Yes, most definitely.
Come to the office. That PMS situation is definitely something that we need to do some serious work on. So, guys, we're bringing this program to an end because very soon we're going to have to join DJ Mamu on djmamuradiott.com. We just finished our live program on Freedom 106.5 FM there. So it's a matter of now going over to DJ Mamu on djmamuradiott.com. That program is going to be anywhere between 2:15 to 20, and we go for an hour. And we will be continuing our discussion with hypertension and prostate. And of course, any questions that you may have, you can actually send it there for us. Okay, guys, take care. God bless and enjoy the rest of your Tuesday.